So I had this patient, right? Get a load of this guy right here. And this patient couldn't dorsiflex. That's bringing the toes towards the tibia, fibula bone right here. Now, it would be lovely just if it were easy and it was a lack of tone in the muscles that happen to do that. But that's, of course, too simple. That's an easy answer, and it was not the case because you can test those and they're firing just fine. What was found instead was that the whole foot, really the talus bone, this one right here, was too far forward on top of the tib-fib articulation, that joint structure right there. And that being the case, it means that what is essentially happening is when the foot does try to go into dorsiflexion, when it does try to do that motion, these two surfaces are bottoming out too fast. They are colliding faster than they should, and it restricts the tibia and fibula from allowing the talus to essentially go backwards through and between them in between that mortise type of joint, as they call it. And another simple answer would have been that there's something wrong with the gait cycle. And there probably is, truthfully. There probably is something wrong with the gait cycle. And you would think maybe it's on that heel strike at that point where the foot is impacting the ground and you've got your heel and you've got your talus, and there's too much of an impact on that contact point, and that's jamming the foot forward. That would be almost lovely in a way, because that's an easy fix. But again, it was not the case, so we have to look somewhere else. What was found secondarily to all this was that the posterior tissues, the gastroc and soleus muscles, what we might call the triceps surae, was short and fibrose. So the gastroc muscle being in blue and the purple representing the soleus, they were tight and short, and they were in fact thickened tissues. So they had become what we might call fibrosed or fascially restricted, and their tension was extreme, but it was a lasting tension regardless of tone, so it was too much. And so what essentially happens when this is short and thickened and creating a lot of pressure, it means that on the posterior side it is short, so that part is short, which means by comparison, and this may be hard to understand, but by comparison the front is long, so there's more space for that foot to translate forward. And even though it may not be an immediate effect, gradually, as those tissues thicken and thicken, it means that foot will tend to be squeezed, pushed forward. There is a pathway of least resistance, and it simply follow that. Now, we then have to ask, why is this gastroc soleus, this triceps surae, why is it contracting excessively? Why is it fibrosing excessively? What was found after that was this position. The patient was too far forward. Again, it would be lovely if it was a simple fix, but it just never is. And so the patient had come this way, as if they were rounding down, which they were, and as a whole, their body was relatively forward. It wasn't too much, it wasn't excessively so, but it was just enough. And so, of course, it's very normal for the extensor muscles to contract. It's very normal for the body to try and pull itself back through that and, say, through the hamstrings. But what you have to understand is that when the tibia also goes forward, what should happen when the body is just put forward in a normal place? When the tibia comes forward like that, the tibia wants to go. Let's clean this up a little bit. When the tibia goes forward as the body goes forward, all you get is just a simple tibia on talus motion. But this was a bit different. Again, it was more than that. It's always more than that. And so what had happened was that the body had gone forward enough. The whole body had gone forward enough that now the angle had changed for the gastroc. The way it was able to pull here was such that because it was attached from here to here, when it contracts, it actually starts to correct the position of the body. It starts to pull back, and it contributes to, say, what the hamstrings do. It contributes to what the erectors can do for posture. And so it means this muscle normally involved in plantar flexion, and certainly normally involved in sustaining the forward weight, actually becomes a global posture corrector. And it's very difficult for it to do that, understand, for the entire ankle joint to move the whole rest of the body backward, that one relatively small muscle by comparison, to move the entire body backwards, takes a lot of strain and a lot of stress. And so that means to effectively do that, it has to undergo great contraction over long periods of time and a lot of strain. So ultimately, to fix this here, we do have to correct this here. You can't just jam it back into place. You got to make sense out of it first. This has been Alex from Simple Lines Anatomy. I hope that made sense.